We've got some huge news to tell you about. This is a joint society press release from the American Society of Plastic Surgeons and the Aesthetic Society. We're going to break it down full throttle. Hey Doc audience, this joint press release from ASPS and ASAPS, which is the American Society of Plastic Surgeons and the Aesthetic Society, and they did a joint press release regarding the breast surgery collaborative community's consensus statement on capsulectomy terminology. And this is a big deal. You know, the societies don't do these press releases very often jointly. In fact, it was great collaborating with them on that, but it's a very important consensus document.
So why is this so important for the consumer to know, and what should they know and take home from this? Because there's so much stuff out there, some myths, some reality, some falses.
Yeah, I mean, I think in high level, you know, there's just a lot of confusion going on the past few years about capsulectomy, and you know, but there's a lot of misinformation on social media and the internet, and people are confused, and patients are being told, you know, for example, oh, you need to have an en bloc capsulectomy. There are some people that are worried their breast implants are making them feel sick, or they have, we call it systemic symptoms with breast implants, and that's also called breast implant illness by some people. But the thing is that there needed to be some standardization. And so the beauty of what this consensus document was, it came from the breast surgery collaborative community. Okay? It was a structure put in place by the FDA. The FDA is not members of these things. They don't run these things. They're basically stakeholder run communities. This collaborative community has 18 people on it. We have people from both societies. We have advocates, we have people from industry, psychologists, a lot of nutritionists. We have a lot of different stakeholders.
So it's a heterogeneous group.
Yes,
and with consumer groups.
And it's a stakeholder run group. And so what we did is we worked actually very hard on a document. It was basically a consensus document on capsulectomy terminology. Okay, what are the different types of capsulectomy? When is certain ones indicated? So for example, the absolute indication and only real indication for an en bloc capsulectomy is established malignancy or cancer of the capsule, or somebody you really think has a malignancy of the capsule. Then that's the only reason to do an en bloc capsulectomy.
It basically takes out the whole capsule and then surrounding normal tissue, right? Which can be and not a benign process.
If you have a malignancy of the capsule, I think that's completely indicated. You should have that.
It's rare.
But there's also been a lot of science showing, say, somebody that has systemic symptoms of their breast implants, it doesn't really matter if they have all their capsule taken out, they have part of the capsule taken out, or no capsule taken out. The outcome is similar. Patients can get better. Some get better for a period of time, temporarily. Some may have more permanent improvement in their symptoms, and there's various reasons for all those things. But the point is that for somebody to be representing to patients that, oh, you have to have an en bloc capsulectomy, and then what happens is they say, oh, by the way, you know, there's only a handful of people trained to do this properly, and oh, by the way, it's going to be
X thousands,
you know, $35,000. That's just exploitation of patients. And so at the end of the day, it's a shared patient decision-making process with the doctor and the patient should be educated about all the science and talk to the doctor, and the patient should have their input. And I do believe, I do this with my patients, if somebody wants to, for whatever reason, wants to have their implant out,
sure,
it's their prerogative. I'm more than happy to do it. But I counsel them about the science, and we do a basically evidence-based approach to the capsule management.
So how do consumers find this document? It's online?
This press release just came out this past week. It's online. We'll have a link to it below here on this video. It's a great step forward. I congratulate all the members of that collaborative community for this work and the efforts that they did to put into generating that.
You need to know this information when you go to your plastic surgeon, because many times you may not need anything, or you may need a partial capsulectomy, may or may not need an implant exchange depending on whether you want it or not. And there's a lot of myths out there, like all implants have to be removed to replace at 10 years. And that's not necessarily true. And all implants do get capsules normally, but most of the time they're okay.
Right.
And as implants age, they can get thicker capsules, but there's no absolutes. And this is what this document talks about. So I think it's a phenomenal thing for patients to read.
That's great stuff. But if you like this, check out this video looking at implant ruptures.